as a lot of you may know, life's getting harder in general practice. I'm not a gloomy person, but we're getting increasing demand from our patients. We've got an ageing population, and funding for general practice is being reduced. And life is getting a lot harder. And a number of us got together a few months ago to try and work out what best way to preserve local family general practices that we all know and love for our staff, for our patients and for ourselves. And we came up with this model of drawing all our skills together to become one organisation, but retaining our differences between each of our individual practices that have evolved for our populations to continue to serve our patients the best way we can.
TUPE stands for Transfer of Undertakings, Protection of Employment. And basically we're having to go through this process because your practice, while it's maintaining its autonomy as an operating unit, is merging into a bigger organisation. And the idea of TUPE is to protect you, the employees, and protect your terms and conditions so you're not disadvantaged as a result of this merger. No, your terms and conditions are protected under TUPE and will not change as a result of the merger. We cannot crystal ball gaze. We do not know exactly what the future holds. There may be reasons in the future why we have to change terms and conditions, and that is as true now in your individual practices as it will be for the organisation as a whole when the merger has happened. So, yes, there will be a point in the future where possibly we could change terms and conditions, but it will not be as a result of the merger. It will be for other considerations which are going to be true for your practice as much as it is true for our health partnership. If we do change terms and conditions in the future, it will be done with full consultation. While technically pensions aren't included in the protection of TUPE, our intention as an organisation is to keep everyone within their current pension arrangements. And actually, as I expect the vast majority are in the NHS pension, our intention is to keep paying into everyone's NHS pension exactly as they are now. As a direct result of the merger, there will be categorically no redundancies. Our view is that the merger actually should create more opportunities than close them. We are going to become a bigger organisation. The bigger organisation will open up places for staff to go in their careers that wouldn't have been there previously, to pursue other interests, to be qualified in other aspects of their job. Say you find HR really interesting. We will support you and help you develop that interest and actually perhaps become one day the HR director for the organisation. I think there will be opportunities for nurses as well to develop specialist skills that they could actually bring out to not just the practice they work in, but a number of practices. And also opportunities for salaried doctors to develop specialist skills as part of a portfolio career across the whole organisation. And also interesting new flexible ways of working across the organisation that may suit people with families. I think actually the opportunities are huge with this and we should try and grasp them. I think from the point of view of training, money has always been an issue for practices, and actually an individual small practice only has a finite pot of money for training its staff. We will be able to really grasp the economies of scale of a large organisation, provide training for large numbers of you, and actually invest much more money in your career development.